Hi, my name is Carrie Furrier. I'm the Executive Director of the SHINE program. I welcome you back to the Medicare and More program. And with me today I have my colleague, Ed Roth. And we also have a guest speaker with us today. We have Maureen Sergi, who is the Executive Director of the Elder Services of Worcester. So we welcome everybody back today. So welcome to be with us.
Thank
Maureen.
you. Thanks for the opportunity.
Yes. So what we'd like to talk to you a little bit about today is that Ed and I are going to ask you a bit about what's the history of the Elder Services of Worcester, what is it, and what services you provide and how people can access those services. So if you could please, could you go into a little bit about what's the history of the Elder Services of Worcester?
Well, Elder Services of Worcester area is an aging services access point. You'll hear us referred to as an ASAP. And there are 26 such organizations across the state of Massachusetts. And it's important to note that in Worcester County, we work together with Tri-Valley Elder Services in the South County, Elder Services of Worcester in the central part of the county, and Montechusett Home Care to the North County. And the ASAPs were created by the state as an alternative to nursing home care. This was back in the 1970s. And the mission of the ASAPs are really to provide programs and services to elders in the community to really enable them to remain in the community for as long as possible with dignity and respect. It's important to note that over the years, as the populations have changed, we've changed along with them. We now provide services not only to elders, but to younger people with disabilities and to caregivers as well.
That's great, Maureen. And I know initially the mainstay of the program was probably the nutrition program.
Correct.
Where, Meals on Wheels and congregate meals and stuff like that. But now the ASAP's involved in a whole lot of other stuff. And you've kind of grown with the ability of folks to get other services. So can you talk about like the nutrition programs
Sure.
a little bit and that concept?
The nutrition program, or the Meals on Wheels program, is certainly the easiest for people to understand. Everybody's familiar with Meals on Wheels. Elder Services of Worcester delivered 413,000 meals last year. So each day, Monday through Friday, we have drivers who actually deliver a hot, nutritious meal into the homes of elders who might be frail, who might be isolated, who really, nutrition is so important to maintaining health. And that not only provides them with a meal, but it provides them with daily contact. Somebody knocking on their door and making sure that they're okay. It's a wonderful service and certainly meeting the most basic of needs. But our biggest program is the state home care program. And that is really a case management model where bachelor's level social workers will go into the home, do an assessment, and oftentimes working with nurses who are on staff, so it's more of an interdisciplinary look at what somebody's needs are. And I should back up a moment and say that the process begins with a phone call. Somebody may call and really not know what it is they need. They might be concerned about a family member. It might be an elder themselves. Oftentimes, hospital discharge planners are in touch with us when something has changed. So we have information and referral workers. We have a database of resources that we share with Tri-Valley Elder Services and Montechusett Home Care, and certainly shortly with the Center for Living and Working. So there's a conversation that takes place to really help determine, is this the best place? Is this what somebody's looking for? Or is it something else in the community? When we say Aging Services Access Point, that really means that we're responding to the individual's needs. That might be our services, or it might be another program in the community. If somebody chooses to have an in-home assessment, that's when it gets assigned to a case manager, and that case manager and the nurse work together to really look at how well somebody's functioning in the home and what areas they need assistance with, what areas there might be a family member or somebody else helping, or what areas somebody's still okay managing themselves. We want to make sure that we really just get in there and work where we're needed to allow a person to still remaining at the highest level of functioning as possible. Once we get into the home, we determine eligibility for our services. And for the basic programs, the state does set income eligibility guidelines, and that's unfortunately always necessary because there's never enough money to provide services to everybody who could use the services. For an individual, that income limit is roughly $27,000 annually, and for a couple, it's $38,000. Now, I don't want anybody to write that down or to say I'm not going to call because I don't fit within that, because we certainly want to hear from elders, hear from family members in the community, because we can respond to their needs and help them go into the right direction to have those needs met, whether it's us or not. So we develop a care plan with the elder, with the family member. We then use state dollars to implement that plan. We actually buy the services that are going to assist that elder. There's a whole menu of services that the state allows us to use that money for, and that the most common is the homemaker service. Somebody to go in and do the cleaning, the grocery shopping, the laundry, things that really are required to enable that person to safely remain in their home. That includes also Meals on Wheels, transportation to the doctor, adult day health programs, a range of services that we really sort of custom design with that consumer to give them input and control over the services that are going into their home.
And so that's very interesting, and I think that's an important piece for everybody to know is it's kind of like one-stop shopping.
Absolutely.
You want people to be able to call in to Elder Services of Worcester or any of the ASAPs that are available, and again, not kind of self-eliminate from programs, but just check and see what you have available. So to call, to make that first step, or the caregivers need to call and make that first step. The clients themselves can call and make that first step, and then can be assessed for what's available and what they would, and you screen them essentially for what programs they'd be eligible for.
Yes, that's correct. But certainly our most important message is call and let us help you figure it out.
Exactly. And that's one of the things that we've noticed with some of the programs, for example, with options counseling, which we'll talk a little bit more in the next few minutes, but really a great service where, again, people can call in and maybe they think they have an issue with one thing, but really they could get help with several different areas. So that's very, very good to know. So interesting service. So I think at that point in time, we might be at the point where we can talk a little bit more about what services are available through your program. So could you expand on that? What kind of programs do you folks offer?
Well, I think that that an area that is certainly of interest to people is the Adult Protective Services program. We are the agency that's been designated by the state to receive and investigate reports of elder abuse and neglect. I will tell you that in 2015, we had 2,250 reports.
Wow.
And just last month, we shattered all of our previous records and received 240 reports.
Wow.
So when we say elder abuse and neglect, we're really talking about physical abuse, emotional abuse, financial exploitation, sexual abuse, caregiver neglect, and self-neglect. Of all of those categories, self-neglect is really, excuse me, the most reports that we receive each month. And that sounds sort of like we might be blaming the person for neglecting themselves, but it really is about reaching out to people who might be getting themselves into trouble because of their own inability to care for themselves anymore. That might be a substance abuse issue, or it might be a long-term unaddressed behavioral health issue, or an issue like dementia, where somebody really, they're becoming at risk because they may not be paying their bills, they may not be able to figure out the appropriate dress on any given day, might be out leaving their homes, wandering a bit, really areas of great concern to us and to the community.
Yes, and I've had a little bit of experience with this too, so it can also be, self-neglect can also come in the forms of somebody's just getting frail.
Exactly.
They could be falling more often. They're not doing good self-care anymore, and they just can't manage those day-to-day sort of activities that they were be able to do before. And again, you start to see it in a person's cleanliness.
Right.
You know, they just don't take care of themselves like they used to. There's usually also other factors that are involved with that as well. But like you said, it's not that you're blaming anybody.
No.
They just no longer have the capacity.
Right.
So one of the messages we really want to get across to people is if they have a concern about somebody, that they can call your agency,
Right.
they can make a report, and that somebody will go out and check on this person and see if they need services or if there is really something going on with them.
Right. You raise a good point when you say that somebody might be just becoming frail because of physical conditions, and what makes it difficult is that oftentimes that person isn't going to admit that because of a great fear of being told that they can no longer live independently. And the whole point of the Adult Protective Services Program is to really work with the elder, work with the family to alleviate whatever it is that's causing the issue with the least restrictive response. So it will go in and we'll do our best to get services in place so that person can remain living independently. If there's a family member who has issues, whether it be just the stress of providing care or it might be somebody else's own physical or emotional problems, we'll go in and we'll try and offer services that are going to enable everybody to continue living in the community. The interesting thing is that, and oftentimes hard to understand, is that adult protective services differs from child protective services in that we're dealing with adults who have the right to self-determination. They can decide whether they want our intervention or not. So we have to get the elder's consent and permission to continue an investigation and to offer a service plan to that elder. The exception to that, which is also very difficult to understand, is the capacity to consent. Oftentimes when we're dealing with people who might be, their functioning level is really decreasing and there might be a cognitive issue, you have to question whether that person really is able to make that decision about receiving services. If we ever have a question, we certainly engage in the process to really make a determination. And that begins with a physician who will do an evaluation and do an assessment and make a recommendation, and then it becomes a legal process. So it really is a very structured approach, and it really is every step of the way respecting an elder's right to make choices, but certainly with some safeguards in place.
Yes, and it might be a simple matter where an elder doesn't know that services are available.
Exactly.
They're sitting at home, deteriorating, and my God, they don't know the services available. I've seen one success story in particular in Milford where there was a lady coming to the senior center periodically, and she didn't know there were services were available. And my goodness, she got hooked into the local ASAP Tri-Valley and was able to get those services. And it's flourishing, and that's the sad part of a lot of these. We have a lot of people out there, either one, they don't know the services available, they may be too proud to ask. And you know, it's a sad thing because the mission, and a lot of us, we're all in this business of assisting seniors, is to improve their quality of life that they're going to have. And we're certainly not interested in overpopulating nursing facilities or anything else. We want to keep people in their homes as long as possible and living a good quality of life where they're really having fun in their golden years. And the fact of the matter is, the ASAPs, all three of them, have services available that can really help folks with this. It's unbelievable some of the stories that we heard that are very positive. Now, as Maureen said, the rare case where competency becomes an issue, well, those are rare, okay? They don't happen very often, but there's a legal means to handle them. And the other important point is it's self-determination. The senior can say yes or no, but at least they have an explanation of what is available to them. and how those services can improve the quality of life that they do have. It's again, all of those programs are wonderful. And I know Carrie mentioned the options program. Now Shine program has trained a couple of option counselors in Medicare and stuff, and you got some great staff in that area. And do you want to explain the options program a little bit?
Sure. We're part of the Central Mass ADRC. I mean, we've got lots of acronyms, but I'll do my best to explain. The ADRC is the Aging and Disability Resource Consortium. There's a realization that services that are provided in the community really need to come together more. As it's not a surprise that the need for services is growing and the complexity of those services is growing, so it's important for us to work together. So the local ADRC really brings together the aging organizations and the disability organizations. And in this area, the 3 ASAPs work together with the Center for Living and Working, which provides independent living services for younger people with disabilities. And also the 5th partner is the Central Massachusetts Agency on Aging. So we've been working together to become more familiar with each other's services, to really minimize the amount of phone calls that it might take somebody to receive those services, and really doing some cross-training and some cross-referrals. But the options counseling service really came from the ADRCs. There's funding that's available for counseling available for any individual in need of long-term supports, regardless of their age, regardless of their income. The purpose of the options counselor is to meet that person wherever they are. We go into homes, we go into hospitals, we go into the local coffee shop, and really help that person determine their own goals and then help match up resources to meet those goals. It's really a self-empowerment model, giving the individual control over their future, and we're finding that it's often people who have fallen through the cracks previously. And certainly one of the big needs is around benefits counseling, and that's where our collaboration with the SHINE program has been so important. Our options counselors at Elder Services of Worcester, we have 4 counselors, and there are 2 available in the North County and the South County and at the Center for Living and Working. Oftentimes somebody has questions about their income and their health insurance. Certainly Mass Health is difficult for anybody to really wind their way through. And the training provided by the SHINE program, so that our options counselors are actually certified to be SHINE counselors, enables us to really meet that person and not have to stop the process to refer and refer and refer. Options counseling is available, as I said, regardless of income, and there's no cost to the consumer for that service.
Very good. And again, as far as the options counselor go, it's the old no closed door thing, because they want folks to be able to call the ASAPs or any resource and really try to get answers there. Once somebody calls, well, you hang up well, we really don't do that. You got to call, and the person may lose the interest.
They get frustrated.
The client may lose the interest, get frustrated, and not call, or something else comes up. So that's again another great program that we're very happy that we can provide some input and train some folks on, because very good program.
Right.
Carrie, what else can we talk about with Maureen?
Well, we touched a little bit about the nutrition services. So you do the in-home Meals on Wheels delivery service, but you also do some congregate meals. Can you explain a little bit about what the congregate meals are about?
There's the congregate meals piece, which we really are trying now to refer to as dining centers. We need to keep changing our language so that people are comfortable coming to us and understanding what it is that's provided. So many of the councils on aging, through their senior centers, host a site so that elders can come and have that nutritious meal. So for anybody who's healthy enough to get out of their homes, they get the benefit of socializing with others. Tremendous program. Again, every day, each of the sites, they know that depending on the town, could have anywhere from 25 to over 100 participants. And these people get to know each other and are able to socialize and become friends. That couldn't happen without the cooperation of our partners like the Councils on Aging. Ed, you mentioned an example earlier of somebody who had been attending a Council on Aging program and really wasn't aware of all of the services that are available in the community. I think that every day we hear people say, we didn't know that these services were there. We work very hard to get the word out. We attend all sorts of health fairs and informational sessions so that people, we use social media now to make sure that people are aware of our services. But for elders, it's a difficult message to hear. Going back to that concern that if I say I need help, somebody might think that I can't stay in my home. And it really becomes a struggle to get people to be aware of those services. And that's why a lot of our other outreach efforts occur with our other partners, like the Councils on Aging, like the hospitals, like so many other, congregations are places of worship where we can get that word out. Hairdressers, wherever we can go, wherever we can get information out, we'll do that to improve people's access to the services.
Yeah, and also a program that we really love. If you're a senior or a couple, and Maureen talked about some income stuff, and you might not think you qualify for Mass Health. Well, there's a couple of programs like the Frail Elder Waiver. That's a very, very important program, and gives a senior or a couple access to some significant help with their medical needs. Briefly, Maureen, a little bit about the Frail Elder program?
Sure. The Frail Elder Waiver is really designed to bring more services to somebody who is on Mass Health so that they can remain in the community. Again, the cost of the nursing home is so expensive, and certainly who wants to move into a nursing home. There's certainly a place for them. They're an important part of the continuum of care, but there are instances where a couple's income might be higher than the $38,000 that I mentioned, but if one of the spouses has a lower income, there are ways that you can separate that income to make that frailer person with the lower income eligible for services. We also provide respite services to caregiver regardless of income. So that's why I don't want those numbers to stick in people's heads. I really want people to call us, because there's also a spend down of the Mass Health 300% waiver where we can look at income a little bit differently, and you probably know more about the details of that than I can explain right now, but the point is, call and let somebody at our organization sort through all of that, and if there's some way that we can make somebody eligible or give them access to services, we'll do that.
Yeah, and again, it's important that you call. That's why we're here. We've been doing this program now for probably 16 months. And the reason for that is we want to make sure that people have the information and know where to access the services. The people at the ASAPs and Tri-Valley Elder Service of the World, Massachusetts, they're the experts, okay? I'm certainly not an expert in a lot of ways, nor is Kerry, but these folks are where the experts lie. And if you need help, they'd be the appropriate people to call to see if we can if you can get that help. Don't sit at home chilling out when you're not feeling too well. Let's get some help in to talk to you and see exactly what in the system, because the system is big. The system has a lot of programs to help you, help each and every one of you, if you need it. And you know, it's the ASAPs are a key part of that system.
I mentioned caregivers earlier, that we're now doing much more work with caregivers, and I think that's important to note today too. There's a recognition by the federal government that the work that family caregivers are doing really saves the government a lot of money. So we need to do our best to support those caregivers. So there is a family caregiver support program, again a collaboration in Worcester County, where we have specialists on staff who do educational events for caregivers to support them. They do one-on-one counseling because certainly that can become very stressful providing care. And there is also limited money that's available to provide a product or a service that might enable that caregiver to continue to provide care. That's our goal, to support the tremendous work that caregivers are doing. We've got a wealth of information available, and I would encourage anybody to call any one of the ASAPs, Elder Services of Worcester, Tri-Valley Inc., and Montechusett Home Care, and really get access to that information that will support a caregiver, information on support groups, and a whole range of options that will meet that caregiver's needs as well.
In the last couple of minutes that we have too, Maureen, would you speak a little bit about the money management program too?
Sure. The money management program is available. There are two components to that. One is what we call a bill payer assistant, and that's for somebody who's maybe no longer able to see to write in their checkbook, or might be having difficulties with dexterity and managing their checks. So a volunteer will go in, a trained volunteer will go in and assist with that monthly bill paying function. The other piece of that is the representative payee, and that's a little more complicated. Certainly tied somewhat to protective services and all of our other programs, where somebody may be getting themselves into trouble because they're not managing their money. So we actually, through the Social Security Administration, become the representative payee. We have about 80 people that we're serving this function for, where we actually, all of their bills come to us. Their Social Security check comes into an account, a very well-monitored account. We're able to get to not only manage the bills going forward, but to help straighten out a budget, excuse me, that may have been causing problems with overspending, for people who just are no longer to manage that themselves. It can make the difference between somebody staying in the community and or not being able to maintain their housing or to pay their bills.
Absolutely.
Yeah.
Well, we thank you very much. I know we briefly just talked about some of your programs that you have available through your agency, but we're very grateful that you came today. And again, the takeaway that we'd like everybody to have is to just please call and see if you're eligible for any sort of services, because it's really important. And again, the mantra is it's a win-win. We just want people to stay home and be supported at home. So thank you, Maureen, very, very much. And
Thank you.
We look forward to next episode.
Yeah, see you at the next show. Bye-bye now.